In the last part of this episode, we saw how the 9th and 12th century Muslim physicians like Al-Razi and Avicenna improved upon the works of ancient Greek physicians and took medicine to a whole new level. Now we will discuss the role of Muslim medics in the fields of surgery and the building of pharmacies and hospitals. The well-known 14th century surgeon, Guy de Chauliac, commonly known as the father of surgery, has a significant book of 7 volumes. The book has a very important appendix, writings of the leading 10th century Muslim surgeon, Al-Zahrawi from Cordoba, whose works are the basis of modern surgical science in Europe. Zahrawi was a genius who became famous in the West after his book was translated and published by Gerard of Cremona in the 12th century. He was responsible for various innovations in surgery, such as treating liver carbuncles by opening and burning them. He is known for performing tracheostomy and surgeries on the patella and uterus. He would also do limb amputations as well as bladder stone and nasal polyp removal. Al-Zahrawi could even perform plastic surgeries and was the first to use strands of cat intestines for his surgical suture. Today, these strands, known as catgut, is widely used in surgeries. For the lower half surgery, Zahrawi suggested that the pelvis and legs are held up, the method known today by the name of German surgeon Friedrich Trendelenburg, who was born 800 years after Zahrawi's death. Zahrawi also invented numerous surgical tools and described them with drawings. The design of these surgical tools are the base for modern ones. He was also the first person who recognized hemophilia and suggested the treatment for it. Zahrawi spent 50 years writing his famous book of 30 volumes, The Method of Medicine, which was used by surgeons up until the 17th century. Muslim medics and scientists are also known for their research in herbal medicine. Georgi Zaidan believes that Arab Muslims were the first people who formed pharmacology and opened pharmacies. The most famous Muslim herbalist and pharmacologist was Ibn Al-Baitar, who collected the majority of the findings by Greek and Muslim scientists and the result of his own experiments in his 2 famous books. Many of the plants he has introduced were mentioned in his book for the very first time. His books were translated multiple times in different languages including German, French, Italian, and English. Muslims also built hospitals, following the example of Persians starting the 7th century. The first Muslim hospital was built in Damascus. In his description of these hospitals, Georgi Zaidan says, Muslim hospitals in those days were very well organized and all patients received treatment with care, regardless of their nationality, religion, and career. In Baghdad's Al-Abudi hospital, patients were given food and medicine free of charge. The hospital was also equipped with entertainment, and patients suffering from sleep disorders could enjoy commodities such as soft music and storytelling. The construction of modern hospitals in Europe and the world was very much inspired by the example of Muslim hospitals.